we take off fully. Okay. Okay. So welcome to this webinar on conflict and health, exploring health challenges in current conflicts. So this webinar series will explore a wide range of health implications of ongoing conflicts and violence in 4 different countries. The last session looked at Palestine. Today, we're going to discuss Ukraine. Next time it will be Sudan. And finally, after that, the Democratic Republic of Congo. So as I mentioned in this second episode, our whole focus will be on the ongoing conflict in Ukraine. So my name is Una Rose Hogan, and I'm going to serve as the moderator for this particular webinar on Ukraine. I currently serve as the Deputy Senior Vice President of the Technical Unit at AmeriCares, and AmeriCares is a health-focused relief and development organisation where we have operations across multiple countries responding to various emergencies and disasters globally. So we have been active in Ukraine since 2022, and I was actually fortunate to be on the initial assessment team who went out to Ukraine just days after the invasion to help establish our response there. One of my own colleagues is on the panel today, and we will introduce them, who will be able to explain in more detail the kind of work that we are doing, say, in the location. So before we begin today, and I can see the numbers are continuing to clock up, a recording of this event will be available on the Irish Global Health Network website following the event. This is also being live streamed right now on our YouTube channel, the Irish Global Health Network. And if you have any questions during the event, please use the question and answer feature at the bottom of the screen. We have 3 moderators present today, some of our team from the Irish Global Health Network. We also want you to share messages from this event on Twitter or any other social media platforms with the hashtag Global Health Matters and hashtag Stand With Ukraine. So please do tag the Irish Global Health Network for this. So I believe yes, our team here is looking after the various aspects there in the chat, which is great. Okay. So just to kind of kick us off and give us a small introduction into this panel session. So more than 2 years have passed since Russia's invasion of Ukraine began, sparking a conflict that continues to have devastating consequences. So the fighting and airstrikes have resulted in over 30,000 civilian casualties, and about 3.7 million people have been displaced within Ukraine, and about 6.5 million are fleeing the country. If you think of those numbers, they're really catastrophic. If we think in terms of the population of Ireland, greater than the population of Ireland is displaced and has fled the country. So during this time, many people have moved to other European countries where refugees have been welcomed and offered some support, medical supplies and so on. So despite minimal changes to battle lines in the second year of the war, civilians remain at high and persistent risk of violence, especially near the front lines and in heavily affected areas such as Kiev and along the Black Sea. So Russia's continued bombing of Ukrainian ports and grain infrastructure has significantly impacted civilian infrastructure. So in Russian-controlled areas, there's very limited information emerging, but what we know suggests a very harsh, tightly controlled environment. So the conflict endures, and the need for support really remains urgent. And we know in protracted conflict situations, this becomes increasingly difficult. So today, we want to raise awareness about this ongoing situation in Ukraine and share valuable insights from our experienced panelists. So stay with us today as we delve a little bit deeper into the crisis and explore some ways that we can actually make some meaningful impact. So what I'd like to do now is actually introduce you to our team of esteemed panelists that we're very fortunate to have with us here today. So we have initially Dr. Glenn Goss. So Glenn is a clinical social worker and a senior mental health and psychosocial technical advisor for AmeriCares. His primary focus is to support the development and implementation of strategies to program existing mental health programs across 15 countries, including Ukraine, and to build new global initiatives. We also have Professor Irina Mogilevenka, an obstetrician and gynecologist from Ukraine. So she's a researcher and a professor with extensive experience in maternal care and has had involvement at the highest national levels in developing protocols and successful implementations of various national and international projects. I know our moderators from Irish Global Health Network will put in more details into the bios there in the chat section, so please do have a look. And we also have Professor Gerard Burry, a Professor of General Practice and Associate Dean for Medical Education at University College Dublin. Professor Burry has worked as a GP, general practitioner, for almost 40 years, and in 2001 he established the UCD Centre for Emergency Medical Science. So in April 2022, he organised a donation by the UCD Centre for Emergency Medical Science of its ambulance filled with clinical equipment to Medical Help Ukraine. And he currently leads a project to train Ukrainian paramedics and medics to treat major hemorrhage in the context of injuries inflicted as a result of wartime activities. So we have a really interesting group and spread of people coming from both, emergency, physical, trauma care, to mental health, to maternal and child care, kind of three fundamental pillars of health that are essential in a context like this, for population well-being. So I think I will start it off with some of the questions that we have been asked and some of the questions that have come in prior to this actual session. So if it's okay with you, Dr. Goss, I'll start with you. The first question I'm going to ask you is, what are some of the differences in how you approach work in a conflict-affected area as opposed to a disaster-focused area? And perhaps give us some introduction into the actual work you're doing in Ukraine right now.
Sure. And thank you for inviting me and for the Irish Global Health Network. And it's really good to be with such a experienced and esteemed panel as well today. AmeriCares is a health-focused disaster relief organization, and we're drawn more and more into protracted conflicts as well. First thing is to have a longer-term outlook than in a disaster situation. AmeriCare supports mental health organizations in Ukraine so that they have the infrastructure and technical and operational skills to ensure they can meet the immediate and long-term needs of individuals and communities. The next thing is to strengthen local partners and to build up a national health infrastructure. So we support the mental health and psychosocial well-being of people affected by the war through 24 partner organizations in Poland, Romania, and Ukraine. Most of them are in the Ukraine itself. Some of the partners, some of those 24 partners are, for example, Family Circle. They developed an online educational campaign that shared evidence-based practices and self-help tools that focused on resilience. This campaign has already reached 93,000 people across Ukraine. UA Mental Health is another one. They're focused on online therapy. They provided over 2,600 online consultations for Ukrainians living in 26 different countries, also mostly in Ukraine. And then Smart Osvita, they developed and implemented a training for over 700 educators and school psychologists to improve their well-being and to support children and adolescents. And, one of the big things is for us is to be able to cover the majority of not only the country, but also in other areas where people have fled to. The last thing is also that self-care is also really important. We made it a point not to underestimate the mental health and well-being and the toll on the partner and frontline healthcare workers, and to have staff care resources available for them when needed. So we provided psychosocial support activities to partner staff, including sessions on preventing burnout, coping with stress, building resiliency, and strengthening their own well-being.
Yeah, and Glenn, it's great to see that you have a focus on care of the healthcare provider because, not only are they healthcare providers, they're also nationals of Ukraine and suffering in just the same way. Have you anything, before I move on to Professor Arena, do you have anything, what are the key, most critical mental health focused aspects that you feel you need to treat currently? Like, what is the key focus area for you, or burden
Yeah,
that?
and I think it is a little bit different between healthcare workers and the general population, although there are definite similarities. There are the aspects of anxiety, depression, increases in suicide or suicidality, and also intimate partner violence and post-traumatic stress type of symptoms. And I think, but we also really focus on, stress reduction because yes, we do need to strengthen the overall mental health national system, especially for those that might have severe mental illness that are exacerbated by war. But on the other hand, most of the population are just like I would be, very highly stressed and need
Absolutely.
stress reduction techniques and other forms of self-help information. And it's come really handy for the healthcare workers that we talk to.
Yeah, thanks, Glenn. Really appreciate that. Professor Arena, if I can move to you, there's many aspects, I think, of the maternal and child healthcare field that we're really interested in. I think many of us remember those reports coming out from maternity hospitals earlier in the, in the war, actually. And I think it hits home to many people when you think of the vulnerability of, a woman giving birth in a war zone. But I think I'd really like to start off asking you, coming from a place of personal experience, from your point of view, how are the lives of being Ukrainian yourself, how is it being affected by the ongoing conflict in terms of physical and mental health?
Thank you very much for invitation and participation in this webinar. I actually believe it was a lot of effect for people, both mentally and physically. Let's say, for me, war started in 2014, and situation was, it was not so active phase of the war, but war started very earlier. And actually, many people were needed to move, change place of living, change condition of life, change place of work. And that was really a lot of difficult things. But when big war was started in February 2022, that was many people left country. A lot of people left country, but still in Ukraine, people suffering a lot from both physical and mental problems, because if there is alarm system working every 2 hours, and if you cannot plan anything, if you do not know exactly feeling of uncertainty, it's most important when you do not know what's happened next. Like that was just, this bombing of Ahmadiyat. So people been just in hospital, and people working in operating in theater, and so it's very difficult, I believe, and it's a lot of stress for people, both being in a country and being outside of country.
Yes. Yeah, I mean, absolutely. And we know like operating in that kind of uncertainty is just, has tremendous long-term negative effects, say, on the body and the health in general. And I remember that, say, after the invasion, say, a team of us we were in Przemysl, which is on the Polish border there, say, with Ukraine, and just the volume, the immediate traffic of people coming through the train stations, bus stations, just on the roads, just in personal cars, and so on, and trying to move on. Yeah, it's probably extremely difficult for those of us not in that situation to really understand when your entire base is obliterated really in many ways. Yes, Professor Arena.
Yeah, and actually now it's more than 2 years, and you see that situation has started to be worse and worse. And this, thank you very much for all things you're doing for mental support, for support of people, because a lot of things done in Ukraine to support people, both in the country but outside. International donors, international organizations provide tremendous support for different areas. Let's say in maternal care and perinatal care, there's tremendous support coming from international organization, but still very difficult to keep to be on track when you really do not know. You're planning to sleep, and you do not sleep during the night time. After that, you're waking up several times. After that, you need to go for your job, but people trying to adjust to that, because do not want to leave country. People would like to stay in a country, but it's quite difficult, really very difficult. And from my point of view, it really affect, and probably affect for future time too, both mental and physical well-being of the people in Ukraine.
And Professor Irina, I think we all know, the research, the literature, and the lived experience, it shows that out. We see generations of effect in many post-conflict areas. If we think of Rwanda, Cambodia, Sierra Leone, Kosovo, where, take your pick of locations. So yes, unfortunately, we can see that. So the need for physical and mental health support is tremendous. I do want to come back to you, and delve in a bit more specifically around the maternal health aspects, which is obviously, as an obstetrician gynecologist, this is your field of speciality. But I'd like to ask Professor Bury, because I'm really interested, Professor Bury, in what you do. And I was fascinated to read that you are helping support paramedic training, say, in Ukraine. I can't think of a discipline more needed, actually globally, in terms of the health professions than paramedic immediate emergency care, because it's unavailable in the majority of the world, right? So I'm particularly interested here in Ukraine, kind of from your experience. How can you adapt like medical training programs for this kind of a setting? Because there must be very specific challenges that healthcare providers in conflict zones like Ukraine face.
Rose, Irina, Glenn, thank you very much for the opportunity to join what's a fascinating discussion, and really privileged to have worked with lots of others in this field and to learn from you all. So this has been a new experience for us to work in this kind of active conflict setting, and also in a country and a culture that we're largely unfamiliar with from an Irish perspective. We're a small, neutral country, and we've been aware of Ukraine. Let me put it like that. It was a country on the other side of Europe that we knew a bit about and were positive about. But the arrival of thousands of Ukrainian women and children, principally in Ireland, from March 22 onwards, suddenly brought this issue absolutely front and center for us. I'm a GP, I'm an academic in general practice or family medicine, have been in my medical school, which I retired from just a year ago. So as with most retirees, it gives me a chance to do my real job once I get rid of the office work. But those hundreds of Ukrainians who came to stay on our campus in March and April 22 included many doctors and nurses and medics, and we began to engage very quickly with them in terms of English Ukrainian medical language courses, and a real joy to meet such absolutely self-sufficient people, I have to say. Very impressive professionally and personally, but also robust. These were people who wanted to get on with it, and I got that message very quickly about Ukrainians and Ukraine. These are people who want to look after themselves and are self-sufficient. My unit within our medical school has not only been a general practice centre, but our special interest has been in pre-hospital emergency care. So for the last 25 years or so, my unit has been responsible for training paramedics and advanced paramedics for the Irish ambulance services, statutory services, defence forces, and doctors working in the community. So we've had a lot of experience of civil emergency care in a pre-hospital setting. And it's been my privilege to work with great people and to work in that field myself for many years. Conversations with our Ukrainian colleagues made it very clear that there was an overwhelming need for medical pre-hospital care support. But we are a small country and a small outfit. So one of the principles I think that stands us well in medicine and healthcare anyway was not to assume that we knew what we could do to help Ukraine. We spent a lot of time talking to people from Ukraine and Zooming with colleagues in Ukraine whom we established links with. And it became very clear that our contribution could best be not to provide what was already there. In other words, basic and standardized trauma care courses, but we had elements of advanced care within our programs that were unavailable within pre-hospital care settings in Ukraine. Now, within the hospital system, those systems are available, but not in pre-hospital care by and large. Forgive me if I'm going on, but just to give you a little of the story, clearly the problem facing our colleagues in Ukraine was that of battlefield trauma, whether affecting civilians or participants in the fighting. And that differs significantly from civilian trauma in that bleeding is the major cause of death. And sadly, if that bleeding is not corrected by the standard measures of dressings and tourniquets and packing very quickly, then people are going to die. But it's very clear from the evidence, and we have excellent evidence and experience here in Ireland and elsewhere, that some drugs, if given quickly enough, will help to control that bleeding on top of the standard measures. And one of those drugs, tranexamic acid, used in lots of measures of hospital practice where bleeding is an issue, has been transformative in the pre-hospital emergency care field over the last 20 years. So, for example, we have about 5,000 cases of major trauma in Ireland each year. And 87% of those patients get TXA largely in a pre-hospital setting and almost all within 3 hours, which is the cutoff for its effectiveness in this country. So we began to not just discuss this option with our Ukrainian colleagues, but we brought small training teams, and our government and charities helped to fund the kit, the drugs and the administration kit. The drug needs to be given within 1 hour, but max 3 hours if it's going to save as many as 1 out of 6 people who will die from bleeding. And it's that effective. But if it's not given soon, then it is ineffective or may have harmful effects. So if we're going to supply and train people to give it, they have to be the buddies, the carers, the people on the scene right up at the sharp end of care, and they have to be able to do this confidently and safely. The drug has to be given into the bloodstream, and actually training people to give intravenous injections is quite a challenge. When we consulted our colleagues and building our own experience here, what we agreed to do was to teach and supply the kit to give intraosseous, into the bone administration of the drug. So in short, we've been teams, our last one was 8 of our colleagues for 10 days to Kyiv to train hundreds of pre-hospital care personnel to insert needles into bones, shoulders or tibias, shin bones, and to administer the drug within an hour, we hope, of the serious injury that their patients have suffered. We've had huge attention. We've had huge participation. We've got tremendous demand, not just for more courses, but for resupply of kit. At best, we can do a little of that, and my colleagues have been brilliant in actually meeting that need. Our government and our people have been brilliant in supplying us with money and resources to do the work. But most of all, I've been impressed with the extraordinary Ukrainian people we've met, and our condolences, Irina, on what your compatriots in Kiev have suffered this week. Talking to my colleagues and friends, the ones I've met in Kyiv over the last year, it is shocking to hear how such a beautiful city that has such a buzz about it can suddenly be subjected to such awful things. Our condolences, but looking at the TV, the extraordinary resilience of you and your people just shines through.
Thank you so much, Professor Bury. You know, yeah, and we'd all like to echo those condolences to you, Irina, but also to the country, really. But Professor Bury, as you were talking there, a couple of things have really struck me. The first is partnership. So partnership emerges constantly as, you know, a critical component of any part of programming. And I know we talk about it a lot, say in the humanitarian space or whatever, but I think it was really exemplified in Ukraine because the systems were, you know, more developed. They were already existing. They were really quite strong. So I will have to say as well, I know from our own work in America is everything, all the mental health work is done in partnership with pre-existing, you know, NGOs, organizations, national bodies, and so on and so forth. And the other thing that struck me was because I was involved in Ukraine at the start, less so now, but at the very start. And one of the things America does is it delivers medicines and medical supplies. And the coordination out of that international coordination office, it was housed from Lviv at the time. You know, when it was a safer zone, say from the cluster system, from the UN cluster system, it was tremendous in terms of providing insight into the medicines that were required, and it was mostly basic, you know, just the basic supplies. So it's really interesting to hear what you're doing and how you're zoning in on this in particular for, say, battlefield injuries, and the impact it will have is, you know, is tremendous once you can train people, say, at that level. Sticking on healthcare providers, Glenn, just before we move on to kind of maybe more kind of in the community things, but Glenn, I was interested. You know, you have expressed there's tremendous mental health needs, obviously, across the whole country. But what in specific, what are the needs of frontline healthcare workers in Ukraine? Like, what has been your experience? You know, we're hearing from Professor Bury, people are being asked to, you know, when I say scope of practice, it sounds silly, but scope of practices have changed tremendously for people, right? You know, an available pair of hands which can be trained to do a specific function, you know, has been. So from your perspective, what are the particular needs of the frontline healthcare providers?
Yeah, and of course, I'm looking at the mental health needs of the healthcare workers. If you remember, you know, Rose, we were going, you know, to Poland back and forth those couple of years, and I would have meetings, Zoom meetings with, you know, leaders of NGOs. I remember one particular leader of a anti-human trafficking organization. And she said, you know, that line of a burnout that's here, we're way past it, you know.
Yeah.
And I think every organization that I talked to, they were pretty much saying the same thing. We've been going for days, months, weeks, you know, we don't know when this is going to stop. How do we take care of ourselves so that we can be more, you know, helpful for you know, for those that are, you know, in need.
Yeah.
And, you know, I think, you know, I had worked in Syria in 2008 and Iraq in 2010 when actually was in Syria when the Iraqis were coming across to Damascus as the safe place. So, and then that kind of turned around again. And I remember, you know, we're now so many years, 14 years into the war from that. And I think, you know, when there is a type of protracted conflict, and I definitely hope it's absolutely not that long, but I know that people just really have this kind of compassion fatigue, you know, their own physical fatigue on top of that. And there's also the kind of the cumulative effects of stress and trauma and the collective trauma effects. And also, we should not forget that this is a country, Irina can tell much better than I, but has faced starvation in the past, has faced you know, other types of conflict, you know, Ireland as well. But yeah, I mean, these kind of collective trauma effects are there too, and that's what I'm really concerned about. And we know that we're going to be working there for a long period of time, because those type of effects, kind of take a while to play out.
Sure. No, Glenn, it makes a lot of sense. And, I'm looking at all of our attendees here and, colleagues on the line. I think a lot of us have worked in conflict and post-conflict settings. And, we see that play out 6 generations down the line.
Sure.
It lives on for sure. Thank you for that. Professor Irina, I'm very interested in maternal, reproductive, maternal and child health myself. So I did want to ask you, would you speak to us a little bit about, what are the threats that women are facing, during this conflict? How is it affecting, sexual reproductive health? We can hear there must be tremendous challenges for intrapartum and, maternal care, during wartime. From the hospital level and provider level, I think we understand that. But from your perspective, what are those threats that women are facing throughout this particular conflict?
Yeah, thank you very much. And thank you very much for all explanation and all we talk about and all your help to Ukrainians, especially at different levels. This is really, really tremendous. It is really important. I would like to say that at the beginning of the war, we had something around 9.4 million of women in reproductive age in the country.
Okay.
And that was around 260,000 pregnant women. And
wow.
Actually, during the first year of the war, we have missed practically 23% of deliveries. So that was moving people, that was people leaving country, and actually during this year, that was tremendous decline in number of births in Ukraine. Several challenges being really in our country, and that attacks of different health facilities, including maternal houses, including maternities, including child hospitals, and many hospitals being actually destroyed. And that was some challenges with staff, because we had some people moving from the country, some people moving internally from one places to another one, and just to start to work in a new place again was challenge. Actually, I would like to tell that during the first year, that was reported that we have missed something like 12% of midwives. And if that was decline in number of physicians, but tremendous decline on number of midwives it was. And during the first year of the war, of course, it was really access in primary care was declined. And study conducted in Ukraine has shown that was difficulties to get primary care, and that was especially for internally displaced people, and that was difficulties with receiving care of pregnancy. Within research conducted in Ukraine, 58% reported that was some difficulties to receive pregnancy care in the country for different reasons. Of course, it was other things and other challenges, and I would like to say, of course, that was crisis in childbirth, safe childbirth, and neonatal care, because women sometimes were needed to deliver birth outside of hospital facilities, and very often that was at shelter. And of course, if it was rocket attacks, and you can imagine that if it happened, it's disruption in surveillance of, let's say, fetus during delivery, and there can be postponed some operation if attack was started. So that was a lot of difficulties during that period of time. Even practically all hospitals have shelters. Another challenges was contraceptive and prevention of unwanted pregnancy and safe abortions. Actually, in Ukraine, abortions, you have to pay for that. And for all abortions on request, you have to pay. And of course, some problems with money, restriction of money and restriction of medicine. So that was some problem. At that time, that was really, really, I would like to say, we actually have never had comprehensive sexual education in Ukraine, but we had some so-called youth clinics where that was tried to be done. But during that period of time, many of them just stopped to deliver services because it was change in national system, and these facilities will not be in, just included in these national services. Another problems was care to people with HIV and sexual transmitted infections. And one very interesting science about that was some publication in Poland about what people started to be interested in. And that was tremendous interest in internet in keywords: condom, rape, HIV, syphilis. Yeah. So this means that people trying to find information on the internet in Ukraine. Another, that was protection of people with different sexual orientation and gender identity, and of course, medical and social psychological problems of victims of violence, different types of violence. In 2023, in August 2023, it was shown that was around 93,000 phone calls from Ukrainians to police to announce some kind of different violence from members or member of Russian militaries. But not many cases been coming to court, something around 225. And the biggest problem is that usually Ukrainians do not want to talk about violence. And a study conducted in Ukraine in 2023 has shown that 40% of those being accounted sexual violence will never ever talk about that. So actually, this is like top of iceberg since information we have now, and we actually do not have information. Yes. And that was a lot of things done, so probably I can just stop, and after that we can discuss.
Professor Irina, the picture you're painting, I mean, the needs are, I want to say, overwhelming. It's more than overwhelming. There's just so many aspects which need to be tackled, say, within that. Just, babies don't refuse to be born just because it's wartime. But all the associated needs, the need to access routine care, for ongoing HIV treatment, the need for urgent treatment for STIs, and then the public health implications of all of that, say for, relocation, say within new populations, spread of, and so on and so forth. It's all just, it's just painting the picture that the needs will continue to be overwhelming. So when people get this kind of fatigue that you mentioned, Dr. Goss, it's so important that we try to renew people's spirits about this, because we cannot afford to have fatigue. If anything, the needs are becoming more compounded and more challenging, in fact, as time goes on. And so, Professor Burey, I did want to ask you something, because it moves us slightly out of just, this vast health needs. But you have a lot of experience in terms of collecting and coordinating donation and ensuring their effective utilization, because you essentially manage this, say, on behalf of, say, the emergency services, say, at UCD yourself. Could you speak a little bit about how that worked in terms of the coordination of that? You're actually muted, Professor Burey, if you don't mind to unmute yourself. Technology is wonderful, but
fascinated thinking about what I'm hearing. So apologies for not pressing the button. Could I comment just on
yes,
what I've been listening to just initially, if I could, very briefly? We're a neutral country, and most of the 1 million euros we've raised for our project over the last year has come from government or statutory services. So as well as wanting to reflect an Irish national position, it's just good business to ensure that our government and statutory donors feel that we're respecting the national policy as well. And that has led us to deliver training in partnership with the Prytula Foundation in Ukraine, whom we were introduced to a few months ago and who've been great partners to us. And that sense of linkage between bodies that we personally have names and people whom we can trust is the most important part of coordination, to be honest with you, rather than great. I signed an MOU with someone the other day, which was laid in front of me. I got 30 seconds to look at the Ukrainian version before I signed it. God knows what I've signed, to be honest, but I trust the people involved not to have set me up. And that really is important. We're meeting on our courses. We are bringing teams of people for chunks, weeks and 10 days to Ukraine to train 50 people in 2 days to deliver the interventions that we're talking about. They come from all backgrounds because we are reflecting that neutrality policy. So they are both civilian and police and emergency services and military. And we are seeing kids come to courses who have come from the front line, and there's a truck outside to bring them back to the front line. That's an experience I've never had before. We're also meeting very experienced and senior colleagues. A couple of things about that experience, though, that I think are important about resilience and healthcare workers looking after themselves. The spirit of the individuals we meet is extraordinary. What we teach them is absolutely new. It is a sense of responsibility that any carer would be daunted by. But we teach them with ruthless honesty, if you like. And honesty is probably the first part of trying to give people some confidence. This could go wrong. This will not save everyone. This doesn't always work. You won't always be able to perform what we are setting out. But you will sometimes save lives with these interventions. And in my experience over decades, actually colleagues respond well to a request to take on responsibility. They respond better to challenge than they do sometimes to simply their noises. Now that sounds perhaps right-wing or whatever, but nonetheless, within the field of medicine, I think that when challenged, people most often rise to that challenge than fail to take it up. I think the second issue that helps them to do their work is avoiding mixed messages. Rose, you mentioned scope of practice right at the start of this, and it sounds like a legalistic term, and it almost is a professional constraint. It's really important that people who are going into these combat or wartime or trauma settings with awfully demanding roles to play are not getting mixed messages about whether they're entitled to do this or not. And confused messages that say administratively, you don't have the ticket to do this, but practically we want you to do it because you will save your buddy's life.
Yeah.
That undermines people, actually, and it cuts away at people in ways that are actually insidious. Part of our training is we actually teach people to do these clinical techniques in very focused training courses, but we actually also ask them to teach someone else to do the same thing. We wish to cascade this process, and half of our training is actually devoted to how are you going to teach this to someone else and to do it safely and effectively. And that added responsibility is one that at the very start of our program, I thought people might rebel against or say, no, we've enough, don't give us more, we've enough in our plan. And we were quite happy to say, drop all that, let's just stick to the skill. But actually, the cascade component has turned out to be the area with the most rapt attention and the most enthusiastic uptake. And the sense of understanding a little about what makes for a good teacher, what makes for a good learner, is something that actually empowers, I think, the people we're dealing with. And that's been uplifting for us. Your question was about coordination. When we go back to the Oireachtas, we met Professor Chris Fitzpatrick, also an obstetrician, is my partner in doing all this work. And we had the privilege of meeting the Oireachtas, our parliamentary committee on foreign affairs and defence last week, and proposing a further extension of our work. And we had that privilege. And we also hosted a group of Ukrainian MPs this week who came to hear a bit about some of what we and other people are doing, as well as to do things in Ireland. But coordination, if I am not convinced of the value and the import of what I'm doing, and that those who participate receive benefit, then I will not convince anyone to do anything, regardless of how much the paper message gets written down. So, to be honest with you, at the heart of all those logistic and technological and pedagogic issues are human interactions. And I think those are the things that we've learned most about over the last year or two.
Professor Bury, thank you so much. I have so many things I would like to say. However, I cannot believe this because I feel we're just about getting started. I'm getting the notification from our moderators that we're actually almost at time. So what I just wanted to do was do a quick round across the three of you and just see, do you have some final parting words that you would want somebody to take away from this or to think of when they consider Ukraine? Dr. Goss, I'll start with you. Any final just remarks?
Yeah, I think, the war in Ukraine, is taxing us to, as humanitarian organizations, to an incredible degree where, we really have to dig down deep and see, and I think one of the things that we have really worked on is working on a multi-year type of strategy. In humanitarian work, and it's probably different for Dr. Bury and Dr. Arena, but I think that in the humanitarian sector, we tend to look at things very much on a year-to-year basis, and we hope to kind of pull out and go to the next disaster really quickly. And I think with these protracted conflicts, we have to really change our way of thinking strategically, but also to really invest, as Dr. Bury and others have done, in the local infrastructure and with these local strategic organizations. That's been incredible for us.
Thank you, Dr. Goss. Professor Arena, any final remarks?
Yes, thank you very much. And I just would like to tell that really coordination and international support is very important. In country, it's done a lot. Actually, a lot of efforts done by Ministry of Health, national organization, government. So a lot of, especially in perinatal and maternal care. But I've been involved in some project delivered from Scotland and is it in NGO, and we have delivered equipment to 61 and supplies to 61 maternities, which can work in situation when there is no electricity, when there is no heating system. And actually that was really fantastic to provide people, and we even look for some result of that because people collected data, and that led us to decrease asphyxia of babies during delivery. So we all are doing very little things, and I believe all together we really can make change. And most important is we need to stop the war.
Thank you, Professor Arena. Those are powerful words indeed. And I can hear a thread through everything all three of you panelists are saying is, even in spite of this acute situation, you are all still thinking of systems building and recovery and how it's going to look like after the war. There's still a really strong eye to that. Professor Bury, do you have any final brief remarks?
I'm not a professional at humanitarian relief. I've never done it before, apart from bumping into colleagues in my own discipline and learning and working with them. So I've really learned and benefited a lot from the privilege of working with so many Ukrainian colleagues and outfits and groups. It's been superb. But what it's mostly given me is an appreciation, not just of what Ukraine was, which was a beautiful, peaceful country. It's given me an appreciation of my own country as a beautiful, peaceful country. And it's given me a stark insight into the fact that just because we believe we're entitled to a peaceful, beautiful country, the world doesn't necessarily agree. We need to be active rather than, I think, passive in ensuring that we look after ourselves and our neighbours.
Thank you, Professor Bury. So we don't have questions, and I just want to confirm that with our, we don't have questions from the group. If you do have questions afterwards, you can always submit them, afterwards, and our panelists would be available to answer them, or myself as well, indeed. And I just want to say thank you to our panelists for contributing to this event. This is, as you know, it's part of a 4-part series. The next event will focus on Sudan. And as you know, things have deteriorated there over the past few months, and even in the past few weeks, in ways that are very acute and very shocking. And I really want to thank you to all of our attendees for showing up and showing support to the people of Ukraine. It's time that we continue with this, that we continue to focus on this, that we continue to look at the health needs, that we continue to find avenues to support the population. Not actually only in Ukraine, also outside. We have to think of those 6.5 million people who are now relocated, not only in the European Union, but all around the world, and are trying to make their way in a whole new world, new languages, new systems, new everything. So there are lots of organizations who are working to reduce the health and humanitarian impacts of the conflict in Ukraine. And so please have a look at some of these organizations' websites in the chat to find out how you could best support them in our work. And also just be aware, this will be on the Irish Global Health Network's website, also on their YouTube channel, and people will look after the fact as well. If you liked this event or have any suggestions, please do take a few minutes to fill out our evaluation form, which is in the chat box. And don't forget, please, to join our next episode of Conflict and Health with a focus on Sudan on the 24th of July. Also, again, in our chat box, you can become a member of the Irish Global Health Network today for any news and developments surrounding global health. We're a body of people, professionals, a lot of health professionals, humanitarian aid and development professionals who are interested in this field of health. You don't need any particular qualifications or anything to join, but just a passion for and a belief, I suppose, that health is fundamental to everybody. So a recording of today's event will be included on the Irish Global Health Network YouTube channel, our newsletters, and on the website. And our thoughts and our hearts, they're with the Ukrainian people, and we'll continue to work in solidarity to help and overcome the conflict in any way that we can. Really appreciate you taking the time to join in the evening for those of you in Ireland and the European side, early afternoon for anyone on the US side, and for anyone around the world. Thank you for taking the time. We hope to see you in a fortnight to talk a little bit more about Sudan. Take good care. Thank you.